Here's a simple way to look at the cranial nerves and how they work and how to maybe remember them. So down here I've got a key that shows blue is sensory, red is motor neurons, and green is both, meaning they have a sensory and a motor component. Starting at the top, the first cranial nerve is the olfactory nerve. And that's easy, it deals with smell. The second cranial nerve is also a sensory neuron, and that's the optic nerve, which deals with vision and sight. The third cranial nerve is your oculomotor nerve, and what that does is it deals with eye movements, and I'll show you. It brings your eyes medial, so towards your nose, and it also brings your eyes up. The third cranial nerve also has to deal with pupillary constriction. So when that nerve is activated, what you'll see is the pupils will constrict. It's a parasympathetic nerve. Your trochlea is a motor nerve, and what that does is it brings your eyes down and in. Your fifth cranial nerve is your trigeminal nerve. It has 3 gemini off your pons, therefore it's called your trigeminal nerve, and it has to deal with upper facial sensation and muscles of mastication, so it helps you chew. You have abducens is your 6th cranial nerve. Notice it's red, it's a motor nerve. So what that does is it abducts your eye or pulls your eye to the side. Brings your eyes out. Your facial nerve, number 7, has to do with facial sensation and facial expression. So I'll do face, sense, and expression. Number 8 is vestibulocochlear nerve. I remember that because it has almost 8 syllables, but that has to do with hearing and balance. Number 9, glossopharyngeal, and number 10, vagus. They're both sensory and motor nerves. And so the way that I like to memorize those together, at least put them into clinical practice, is these together make your gag, cough, and swallow reflex. And what happens is typically when you're using, let's say, a tongue depressor, you'll hit the back of the throat, and number 9 picks up that sensation, and number 10 carries out the gag. Number 11 is red. It's a motor nerve, and it's your spinal accessory nerve. It's meant for shrugging the shoulders. And number 12 is your hypoglossal nerve, and what that does is it moves your tongue side to side. Now, if you were to look at this face over here that I've drawn, I'll just show you where these nerves live on the face in sort of a cartoon representation. So, start from the top. Olfactory is smell. That one's easy. Goes right here. Your optic nerve is vision, so I like to put that right here in blue. Your third cranial nerve is your oculomotor. And what that does is it moves your eyes medially. It also moves your eyes up, so I'll put the 3 up there as well. And then remember, it also has to deal with pupillary constriction, so I'll put a 3 right in here as well. And 4 is trochlear, so it moves your eyes down and in, so I'll put 4 right here. 4 right here, moves your eyes down and in. And 5 is your trigeminal nerve, and that's a sensory and motor neuron, so I'll put it right down here. And I have an arrow pointing to the upper face and muscles of mastication. And I'll put a 3rd arrow just because it's a trigeminal nerve. 6 is your abducens, pulls your eyes laterally, so I'll put the 6 right out here. 7 is your facial nerve, and so I like to give this guy dimples as a reminder that it has to do with facial expression. We'll put a 7 up here as well. 8 is vestibulocochlear, hearing and balance. That one's easy. We'll put that one right here. Put an 8 right there. And 9 and 10, I like to put those right here in the back of the palate, just as a memory aid. 9 and 10, because that's where you'll do a gag reflex. And spinal accessory, I'll put over here on the neck and shoulders, because you usually test that nerve with a shrug test. And then the last but not least is number 12, your hypoglossal nerve, and I'll put it right here. Now, a couple of reflexes that are worthwhile, like in a coma exam, just to tie this whole board together. If I'm going to do a corneal reflex, and what you do with a corneal reflex is you take a piece of gauze and you rub the white of their eyes to see if they're in a coma. And what normally would happen is if you rub the white of the eyes, the lid will close. And so what you're looking for, I'll put 5 in here as well. What you're looking for is that the sensation of the upper face, eyes included, picks up the impulse with 5, and then the facial nerve, number 7, causes the eye to slap shut. That's perfect.